Hi, my name is Petya. The full mouth restoration treatments are usually needed by patients. In most cases, they have been really afraid to go to dentist due to certain reasons, like it could be probably a bad experience in the past in the dental chair, which stopped them from going to the dentist for 5-10 years, which is a really long time. And they come to us in a stage where, yes, nothing already could be done really to save any of their teeth. We have many patients who would come and sit in the chair and say, oh, you haven't seen such bad teeth. We've seen everything, I would say. So there is nothing to worry about, but yes, these are patients really who are afraid of going to the dentist, most of them. When we can't save none of the teeth, really, this is the question, and that's the only decision is going for 014, 016 options, which can restore functionality and aesthetics as well. So 014, 016 we mostly do. 012 there is also an option for the lower jaw, but this we would really make it as a compromise when the patient doesn't have enough bone for 4 implants. All these options, that means 012 is so all the teeth are on 2 implants, 014 all the teeth in one arch upper or lower on 4 implants, or 016 when the whole arch of teeth is on 6 implants. Of course, these are very sophisticated restorations, which brings really the patient feels the closest to like when they had their own teeth. Very important after having implants, it doesn't matter if it's 012, 014, 016, even if we have 018, 010, the most important thing for the patient is really the oral hygiene afterwards. The difference in the price in all these 014, 016 options also comes with the material what is done the final restoration. The removable denture is the cheapest option, it's acrylic denture. With the other option of having a hybrid bridge, it is the same, the material is the same, and the most expensive option is porcelain bonded to metal bridges or zirconium bridges, which I personally suggest when we have 6 implants, because we have the best support as possible, and the highest with the zirconium, obviously we can get the highest aesthetic result. Implant placement procedures, I would say, yeah, patients of course they are scared of having them. However, it's really not so scary as it sounds. Placement of one dental implant, sometimes it could take 10-15 minutes, and it could be faster and easier comparing to difficult tooth extraction, for example. So after an implant placement procedure, the patient will look absolutely the same after going out of the surgery. He will be absolutely the same like when he came to the surgery. Most patients get scared when we tell them you need a sinus lift, and they're like, what is this? So the sinus lift is procedure which is usually needed in the upper jaw. We have our sinuses located in the upper jaw, which obviously these are cavities full of air. They're normally there. So sometimes either anatomically or due to bone resorption, if the patient have lost teeth long time ago, the floor of the sinus is very low and we don't really have enough bone to place these implants. So if we don't have these 8 millimeters of bone to the sinus, then we need to do this sinus lift procedure. We're waiting for everyone who wants to have their smile back.